Hello, my name is Brandy and I'll be your CTC nursing student today. How are you? Great. Today I'll be performing your head to toe assessment. Is that okay? All right. First I need to verify your name and date of birth. All right. Can you tell me who the president is? Can you tell me where we're at? And do you know what month it is? All right. Based off that information, I'll be able to tell that my patient is alert and oriented ×4 or not. And if their speech was communicated well, garbled, any dysphagia, anything like that. Are you having any pain today? If so, on a scale of 0 being no pain, 10 being the worst pain, could you describe it for me? All right, thank you. Do you need to go to the bathroom? Is there anything we can do to make you more comfortable? I would also check and see if they had any allergies at this point. From the moment that I walk in the room, I will be assessing my patient, checking any IV sites for infiltration, just cleanliness of the patient, cleanliness of the room, the positioning of the catheter bag, any monitors, blood pressure, anything that's going on, and just get a general appearance of my patient as soon as I start walking in. So if it's okay, we would like to move on to your head to toe assessment, starting with your head and moving down, okay? First thing I would start with is inspection. I would be inspecting for symmetry, bony structures, is the hair shiny, dull, and on palpation, I'd be looking for the same thing, any protrusions, lesions, infestations. So then I would go ahead and move down to his face, and we would test cranial nerve 7, and to do so, we would have you wrinkle your forehead, close your eyes tightly, puff your cheeks, and smile. From that point, I would go ahead and palpate the frontal and maxillary sinuses. So, do that. And document, your results. Then I would go ahead and check your temporal pulses. You want to check the both left and right. And document the rate and rhythm, whether it's regular, irregular, bounding, 1+, 2+, and 3+ being normal. Okay. Then I'll move down to the eyes, and at this point, we would start inspecting the eyebrows and the eyelids. We want to look for hair distribution, lesions, bumps, masses. We would want to check the sclera and make sure that it's white. We want to palpate the lacrimal ducts for puffiness, tenderness. Then we'll go ahead and move into Perla, checking to make sure their pupils are equal, round, and reactive to light and accommodate well. All right, his pupils are equal and round. Okay. All right, great. Stare at this pin for me. All right, accommodation's intact. To check cranial nerve 2, we would want to, the ophthalmic nerve, we would check for near vision. You would have the patient just read something about 14 inches from their face. And to check cranial nerves 3, 4, and 6, we would check that by doing the 6 cardinal fields of gaze. All right, if you could stare at this pen for me, please. All right, and they're intact. This point we would go ahead and move down to the nose, where we would start with inspection. We would be inspecting for symmetry of the nose and symmetry of the septum. We would want to palpate the septum, and for alignment, we want to inspect for swelling, oozing, blockages, foreign objects in the nares. You would also want to check patency of the nares, and in order to do that, you could have your patient close one nair, blow out, close the other nair, and blow out, just to make sure that they are patent. From this point, I'm going to go ahead and move to the mouth and oropharynx. When looking at the mouth and oropharynx, you want to start with the lips, inspecting, making sure that they're not blue, discoloration, cracking, dry. Then we're going to move into the mouth. You want to be looking at the tongue, making sure that it's not dry and that it is a good pink color, not a deep red, not cracking. You would also be inspecting for caries, lesions, ulcers, anything like that. You would also want to do a check for odor and just cleanliness of the mouth. We would also want to check cranial nerve 10, the hypoglossal nerve, or the vagus nerve. To do that, you would have your patient stick out their tongue and say ah. When doing so, you would want to check for a symmetrical lift of the uvula. From that point, we would want to check the cranial nerve 12, the hypoglossal nerve. To do that, you would have your patient stick out their tongue and move it side to side. So, all right. We're going to go ahead and move to the ears. From the ears, you want to start with inspection. You want to inspect for symmetry, making sure that the ears line up correctly. You want to palpate the tragus and the auricles for lesions, bumps. You would also, when you're inspecting the canal, you want to check for any kind of discharge and tenderness. Then we would want to check cranial nerve 8, auditory nerve. To do so, I'm going to turn him. You could perform the rubbing test, where you would rub your finger on one side of the patient or the other and ask them to raise their hand when they hear the sound. Okay, so now we're going to move down into the neck, and when we move into the neck, first we want to start with inspection. We want to, through this process also, we'll be sure that we're palpating the skin, making sure that the skin is warm, dry, and intact. The same with the neck. We would start with inspection, inspecting for symmetry, making sure the trachea lines up midline, that there's no goiters, JVD, anything to that such. Want to palpate the skin, make sure that it is warm and dry and intact. We would go ahead and start with the lymph nodes. You would start under the chin and move around down into the neck and to right above the collarbone. From that point, we would go ahead and assess trachea midline. You just palpate the trachea, making sure that it's not out of midline. We would also want to check the carotid pulses, and when you do the carotid, you want to check them one at a time. So we'll check one and move to the other. And when do you check these? You want to be checking for a full minute. After checking the carotid, you would then want to listen into the carotid for bruits, which would be a whooshing sound that you would hear. You would check them one at a time. Have your patient take a deep breath and hold it using the bell of your stethoscope. Okay, From this point, we would go ahead and check cranial nerve 11, the accessory muscles. To do so, you would push down on your patient's shoulders and ask them to lift up, making sure that it is intact. We're going to go ahead and move down into the arms. When assessing the arms, you definitely want to start with inspection. Inspecting, make sure there's no swelling, dryness, crackingness, making sure your IV sites are good, if you have IV sites. Checking color, moving down into the hands. You want to check the fingers. You want to check range of motion of the fingers. You want to check shape and symmetry, making sure there's no clubbing. You would also want to check for good cap refill, less than 2 seconds on both the left and the right arms. You would also want to check the radial pulse on both sides, as well as the brachial pulse on both sides. You want to do both of those. Then when you're checking the pulse, make sure you want to check for a full minute. You would also have the patient perform range of motion, which for the neck, it would be, you can have them move up and down, side to side. For the arm, we would want to do flexion and extension. To check strength, you would have your patient squeeze both fingers, okay? And then you could have your patient pull against your hands and push against your hands to check strength. Normal being 5+. From this point, we're going to go ahead and move down into the anterior chest. We're going to start with an inspection, making sure there's no barrel chest, that it's symmetrical with the body. We want to go into palpating the skin, making sure it's warm, dry, intact, palpating the chest, making sure there are no deformities, bruising. Then we're going to move on to assessing the heart. We would want to start with the aortic, which is going to be the second intercostal space on the right side. Then move to the pulmonic, second intercostal space on the left side. When listening to heart sounds, you definitely want to be listening for a full minute when you get to the apical or mitral. The tricuspid, which is the fourth intercostal space. You also need to have the Erb's point, which is the third intercostal space on the left side. And then the mitral, which is going to be the fifth intercostal space on the left side, midline with the clavicle. This is also known as the point of maximal impulse, PMI, and you would want to listen for a full minute. From this point, we're going to go ahead and listen to our patient's lungs. You want to start right above the clavicle and move down. Remember that the right side has 3 lobes and the left side has 2. Have your patient take a full breath each time. And you want to alternate sides so you can compare the left to the right. Be sure to get that lower lobe good, going mid-axillary. I go ahead and turn my patient so we can listen to the posterior from the apex to the base of the lung. When assessing the posterior side, you want to make sure that you landmark your scapula and your vertebral column. You want to be sure to stay in between. You don't want to be over the scapula. Make sure your patient is taking deep breaths. And while we're here and we're seeing the posterior chest, we would want to perform inspection. Like I said, make sure you get those landmarks of your scapula, your vertebral column. You would want to palpate your vertebral column and make sure that there's no step-offs, deformities, contusions, abrasions. Palpate. We're going to go ahead and move into the abdomen. When doing the abdomen, you want to be sure that you look, listen, and then feel. You don't want to cause any overactive, hyperactive bowel sounds. We want to look from the mid-abdomen down to the pubis. We want to be looking for bulging masses, pulsations, hernias. Then we want to listen. You want to start with the right lower quadrant, move up to the right upper, over to the left upper, and down to the left lower. You would want to be sure to document if your patient had hypoactive, normoactive, or hyperactive bowel sounds. Sometimes it may take a few seconds, no more than 5 minutes. You definitely want to report anything over that. From this point, we're going to move into palpation. You can start with light and move into a deep palpation, starting with that right lower quadrant and moving around. We would look for guarding and tenderness. From this point, we're going to go ahead and move down and find those inguinal lymph nodes, palpating those. We would also want to palpate the femoral arteries on both the left and the right side. Documenting their rate and rhythm. One thing that I realized I didn't do is when inspecting the chest, you want to document the respiratory rate, rhythm, how deep it is, and work of breathing, as well as lung sounds. You would want to document the rate, rhythm, any abnormalities, crackles, wheezing, rales, stridor. Okay, so we're going to move into the lower extremities. When assessing the lower extremities, you want to start with inspection. We want to be looking for cleanliness, for if there's any balding, alopecia, cracking, swelling, edema. If there is edema, you would want to document what rate the edema, 1+, 2+, 3+, 4+. You would want to palpate the popliteal arteries on both the left and the right side, as well as palpating the dorsalis pedis on both sides and the posterior tibialis on both sides. And that's located right in here. While here, we would want to have your patient check plantar flexion, which is pointing the foot down, and dorsiflexion, pointing it up. In the feet and the toes, you would want to do cap refill, making sure that it's less than 2 seconds. Note any kind of ulcers, discoloration, cracking, fungus of the toenails. We would want to check range of motion and strength. You could have them do flexion and extension. To check strength, you would want to check each leg individually and then together at the same time. So by doing that, you can push on the leg and have them push away from you on each one. You could also have them pull. Place your hand behind their leg and have them pull down. Then you would want to do it together. You would place your hands on both legs and have them lift up, have them pull back. After this, we would want to assess gait. Have your patient walk a few feet if they're able. When doing that, we want to look at ease of movement, muscle coordination. Then we would want to check for balance by doing the Romberg test, and that would be where you have your patient close their eyes and put their arms out. You would want to watch for drifting. You would want to stand to the side so that way if your patient was to get wobbly, you're there to catch them. Then we would also want to have them perform to check cerebral function. You have them close their eyes, put their arms out, and touch their nose with their finger alternating. After that, we would be finished, so I would ask my patient, is there anything I can do to make you comfortable? Do you need to go to the bathroom? You could also reassess pain at this point. Then I would be sure to wash my hands. And that is it. So that I had the reference manual just in case.